My name is Dr. Matt Ward. I practice ophthalmology at the Riverwoods Eye Center in Provo, Utah. I've been doing vision protection therapy in my clinic now for 2 years, and it's been really a wonderful experience to finally have something to offer my macular degeneration patients who are frankly desperate for something that's effective and proven to reduce their risk of progression in this terrible disease. My first introduction to macular degeneration was long before medical school. My grandfather had macular degeneration and lost most of his vision in his later years. And as a teenager, I remember seeing him struggle to read. He would listen to audiobooks. It also affected his mood. He had quite a bit of depression, and toward the end of his life, it was extremely difficult. I've seen this mirrored in my patients as I've become a physician and treated patients with macular degeneration, how it not only affects their functional abilities, affects their emotional and several other parts of their life as they face the prospect of going blind. It's phenomenal that after many years of telling patients, other than vitamins, there's nothing else we can do, it's become really a joy in my practice to have something to recommend to patients that I feel confident will help reduce their risk of progression to wet macular degeneration and also their progression to severe vision loss and dry macular degeneration. I was first introduced to the use of modern retinal laser therapy for macular degeneration that's become known as vision protection therapy by a patient wanting someone to do this for him in Utah. I have experience with retinal lasers, actually a cornea specialist by training, so I do a wide variety of things other than retina in my day-to-day practice, but I was intrigued by this option and was skeptical, frankly. I discussed with several of my retina colleagues who had heard of the treatment but didn't have much experience with it. I also started reading a lot of the papers that have been published by Dr. Luttrell and others to find out what was behind this treatment, what was the evidence suggesting that it works, and ultimately went to Ventura and spent time with Dr. Luttrell, training with him and learning from him regarding how he treats his patients. I was very impressed by his 20 plus years of experience with micropulse technology, his approach, his and his data, thousands of patients over many years, showing real-world clinical proof that this is an effective therapy to reduce risk for progression to wet macular degeneration. These experiences and my patients essentially demanding it motivated me to start vision protection therapy in my own clinic. After starting laser therapy for macular degeneration in my clinic, I realized that really immediately it was pretty clear that this not only is a preventative procedure, but there is a percentage of patients that see better after vision protection therapy with the micropulse laser. I never tell patients that they're going to see better. I tell them this is not the point of the procedure. The purpose of the procedure is to prevent progression of macular degeneration. But I can tell you there's a clear benefit to vision in a population of patients. Even after my first day of using the laser, I had patients that I called afterwards that were saying, I'm seeing better. I'm actually seeing things I haven't seen in years. And it's not 20/20 vision, but it's enough that these patients who have suffered year after year watching their vision get worse, it's life-changing for them to all of a sudden have something that's actually improved their vision in some circumstances. I've had patients in tears at times telling me what a difference this has made in their lives. And not only noticing some vision improvement, but also just that the fact that they can trust that there's reduction in the chances of them going blind over their lifetime, which is a huge thing for them. Sometimes it's hard to explain fully the reasons for doing micropulse laser for macular degeneration. And like any preventative procedure, it requires commitment and buy-in from the patient. They need to understand that this is a preventative procedure. It's not expected to improve their vision. It may not improve their life day to day, but it's important to do continuous therapy to achieve the beneficial reduction in risk. Occasionally patients, they'll do the therapy for a few sessions, and then afterwards they'll drop off. And like any preventative therapy, there's people that will stick to it and people will drop away because they don't see a benefit necessarily. And so that's always hard to communicate that how important it is to stay with the treatment, because that's where the evidence shows that over time there's a significant reduction in risk. It's easy looking at something like this to be skeptical. It's easy to look at this treatment as on the fringe, or maybe not something that others are doing. That's totally understandable. I think any significant change in medicine in general, there's a lot of resistance early on. My experience, just in the beginnings of this movement, is that this has the potential to change millions of lives. I mean, this is the single greatest cause of vision loss in the developed world, and our population is aging at a rate we've never seen before, and so there's huge need for this. I think as patients start to experience this, as doctors start to have their own experiences with this will be something that can become a worldwide movement toward preventative therapy for macular degeneration. I tell patients that this is essentially kind of resetting the cells that support the retina. So there's this pigment layer behind the photoreceptor cells, the rods and the cones that most people have heard of. And it's kind of the support team for those cells that has started to have problems due to this disease. And essentially what the therapy does is it rejuvenates the ability of those cells to heal themselves, and it improves whatever processes is needed to happen to prevent progression. That may be eliminating waste products more efficiently. It may be inducing proteins like heat shock proteins and allowing them to perform whatever cell-saving processes they do. But the large studies show that it indeed does, and that my personal experience verifies that. I mean, every ophthalmologist has sat in the chair and they've felt the frustration and the pain of these patients. I mean, that's what it comes down to. I think that if you can only say to a patient so many times, there's nothing else we can do. And if you learn of this treatment and this therapy and you read about it, you actually learn that there is something we can do. And in my mind, where it's such a low risk treatment, I mean, there's so little downside to it, I frankly, I don't see how you can stand by and say, well, I'm not going to at least explore this or offer it to my patient through someone that does do it. And so I think over time, doctors may decide that it's not something they want to do personally, but they should consider it as an option, that there is real evidence that supports the use of micropulse laser to lower risk of macular degeneration progression. In some ways, it's challenging. It's hard to do this as one of the first people doing it, because you're constantly scrutinized by your colleagues, by patients. So there's been many times where I've kind of sat down and said, is this something I should be doing? Is this something that is truly a benefit? And in the end, I don't even know how I could stop now. I mean, the patients are so grateful. They keep their appointments. I mean, that says it all. They're not stopping. They're motivated, and so I think that I don't see how I can't, or how I could go forward not offering this service to patients who are really in need. Well, I think a lot of patients are apprehensive when they first hear about this treatment. I never push them to do this. It's something that I want them to read about, to become educated about. I consider this something that we decide to do together. And I think after their first treatment, a lot of that drops away because they can tell, oh yeah, this didn't hurt my eye. There was no pain involved. It was really simple. It was short. And so I think a lot of those initial apprehensions go away after they've had that first treatment. There's some mild discomfort associated with the lens that's put on the eye to magnify the doctor's view. There's some goopiness in the eye after the gel that we use for the lens and things, but there's really no pain, and patients after doing it, it's really